So brushing and flossing is going to be a little bit different.
Okay.
Take it, tie it like a sewing needle. Then you go up underneath the wire, floss between the teeth, then pull this out. Make sure you don't grab both sides because you'll pull the wire right out.
Oh, yeah. Okay.
All the way back. It's going to be hard to get between those molars back there.
Yeah.
But very important that you do it every day.
Okay.
These are little, they look like little Christmas trees. They're called proxy brushes. They go between the brackets just like that.
Cool.
This does not replace flossing. It's an addition to.
Where do I get those? Are they
Here.
in my... All right.
Or at the grocery store. They're called
they're in there?
interdental brushes, yeah.
Okay.
Wax is going to be your best friend for a couple of days because the brackets, as your cheeks are getting used to them, you're going to take a little piece of wax, roll it between your finger, like the size of like a frozen pea. Just take it, squish it wherever it's bothering you. It's beeswax, so if you swallow it, it won't upset your stomach. Take the wax off before you eat or before you have anything hot because it'll make a mess. You'll probably notice in the back that the brackets are scratchy. Use the wax. Your cheeks will eventually build up scar tissue so that it doesn't you'll get used to that. Your new toothbrush. Charge it for 24 hours. Change the head every 4 to 6 months instead of every 6 months like that. So we want it, shorter intervals. Brush 2 minutes on top, 2 minutes on the bottom. This is a 2-minute timer, so we have to turn it on again. Inside this box are the little heads that have the little plastic like pieces with the yellow plastic pieces. Put this in the cupboard. Don't use that until you get the braces off because it'll pop the brackets.
Okay.
This little sensor here will tell you if you're pressing too hard. The toothbrush will do all the work.
Okay.
So brushing with this, when you brush, don't just brush straight at the bracket. See how it's just brushing the bracket? Angle the toothbrush above the bracket.
Okay.
And below the bracket, and make sure you're also massaging the tissue. This toothbrush will do all the work. All you literally need to do is just put that in the right angle. What you can and can't eat.
This is really good stuff.
So, nothing sticky, chewy, or gooey. Absolutely no gum, no gummy bears or jujubes or anything like that. Suckers, if you can suck on a sucker without biting into it, you can have it. But as soon as you bite into it, then you're at a high risk for breaking brackets. You can have pizza, just not the pizza crust, like the really crunchy pizza crust. Chicken on the bone, ribs on the bone, corn on the cob, all that stuff needs to be cut off, bite-sized pieces, because you'll bite into it. You don't have to worry about the chicken or anything, though. Doritos, taco chips or the hard taco shells, try to stay away from those. Absolutely no popcorn. The little hole inside the popcorn gets stuck under your tissue. Apples, raw vegetables like raw carrots, raw celery, things like that. You can eat them, they just need to be bite-sized pieces. No biting in the front, no incising into stuff like that. You can chew on those molars, but careful to not use your front teeth for stuff like that. Nuts, no almonds, no hard nuts or anything like that. Cashews are a little softer, so as long as you're biting on your back teeth, you should be okay. But I'm trying to stay away from almonds. And no peanuts like with shells or sunflower seeds with shells or anything like that. No chewing on pens or pencils, no biting your fingernails, and never, ever, ever chew on ice.